If your face suddenly gets hot when you stand up, not a flush but actual heat behind your eyes, your body might be screaming about your blood pressure, and you're writing it off as getting older. About 1 in 3 people over 60 has dangerously high blood pressure right now. But here's what most doctors don't have time to tell you during a 15-minute visit. A 2024 study tracked 2,847 adults who showed up at emergency rooms with stroke symptoms. 68% had seen their regular doctor within the previous month. Their blood pressure seemed fine during that appointment. By the time we finish, I'm going to show you the one measurement doctors almost never do in the office. And when hospitals started requiring it in 2023, they caught cases that routine checks had missed for years. But we need to talk about what your body's actually trying to tell you first. The medical establishment spent decades calling high blood pressure the silent killer. That phrase did something dangerous. It convinced people their bodies wouldn't warn them. A 2022 analysis looked at 8,743 patients with confirmed hypertensive crisis. That's blood pressure at 180/120 or higher. 78% had vague symptoms or nothing at all. But that means 22% did have symptoms. Nearly 2,000 people whose bodies were sending signals. The problem? Those signals get mistranslated. Sudden facial warmth when you change position, blamed on menopause. Vision changes that come and go, you assume you need new glasses. Chest tightness during an argument, not during a walk, dismissed as anxiety. A woman named Carol, 67, told her doctor about headaches that started at the back of her skull, worse when lying down, didn't respond to Tylenol. Her doctor ordered an MRI for migraines. It was her blood pressure, 186/98. That specific headache pattern, back of skull, positional, resistant to over-the-counter pain relievers, shows up in hypertensive crisis about 40% of the time. A 7-year study out of Japan's Jichi Medical University tracked 3,400 adults over 65. They weren't looking at average blood pressure throughout the day. They were looking at the morning surge. That spike that happens in the first 2 hours after you wake up. People whose blood pressure jumped 35 points or more during that window had more than double the stroke risk, even when their overall daily average was well controlled. Think about that. Your 2 p.m. reading at the doctor's office might be perfect, but if your body's slamming from 120 to 165 between 6 and 8 a.m., that's when the damage happens. The research suggests this is why about 40% of cardiac events happen in the morning hours. Your blood pressure spikes, your blood gets stickier as you wake up, and your arteries are stiff from lying down all night. And almost nobody measures it during that window. This is where it gets frustrating. There's a condition called masked hypertension. Normal at the doctor's office, high everywhere else. A 2023 study in JAMA Internal Medicine followed 888 patients aged 55 to 80 for 5 years. 18% had masked hypertension, and their cardiovascular risk was identical to people with sustained high blood pressure, but it was invisible during office visits. Here's the bigger issue. The U.S. Preventive Services Task Force changed their recommendation in 2021. They now say you can't diagnose high blood pressure from a single office reading. You need either ambulatory monitoring or home measurements over 3 to 7 days. Most doctors' offices haven't caught up to that yet. Okay, here's the test I mentioned at the start. It's called postural blood pressure testing. And when hospitals started requiring it for patients over 65, they found something striking. You measure 3 times, once lying down for 5 minutes, once sitting after you stand up, once standing after a full minute. If your blood pressure drops more than 20 points systolic when you stand, that's orthostatic hypotension. It means your body's not adjusting properly to position changes, and it dramatically increases fall risk. But here's the other side. If your blood pressure spikes 15 points or more when you stand, research from Cleveland Clinic suggests That's an early warning sign of poor vascular control. Neither of those shows up if you only measure sitting down. If you're going to measure at home, and the evidence really does suggest you should, the device matters. A 2023 validation study tested 47 current monitors. 83% of upper arm automatic cuffs met clinical grade accuracy. But wrist monitors and finger monitors? Most don't. The American Heart Association keeps a validated device list on their website. Just search AHA validated blood pressure monitors. I'll put that in the description. Look for one that stores multiple readings and calculates averages, because single measurements don't tell you much. You've probably heard that 130/80 is the new cutoff for high blood pressure. That changed in 2017, and it confused a lot of people. Because for decades, 140/90 was the line. The change came from the SPRINT trial, a massive study that showed adults who got their systolic pressure below 120 had 27% lower cardiovascular death rates than those who stayed in the 130 to 139 range. But here's the part they don't always explain. That trial excluded people with diabetes, prior stroke, or dementia. Those conditions affect 40 to 60% of adults over 70. A 2024 reanalysis from Johns Hopkins found that for healthy seniors, aggressive control to below 120 helps. But for frail seniors, multiple health conditions, high fall risk, already taking 8 or more medications, pushing too low actually increased fall-related injuries without reducing heart attacks. Your doctor's making judgment calls based on your individual situation, which is why the conversation with your doctor matters more than the number on a website. So here's what this all comes down to. The test hospitals are now doing, postural blood pressure measurement, catches two things routine checks miss. It finds people whose blood pressure crashes when they stand, which explains their dizziness and fall risk. And it finds people whose blood pressure spikes with position changes, which tells you their cardiovascular system is struggling to regulate. Mayo Clinic updated their protocols in 2023 to require home confirmation over multiple days before starting anyone over 65 on new blood pressure medication.
The biggest takeaway?
If you're over 60 and you haven't measured your blood pressure at home, in the morning, multiple days in a row, you don't actually know your cardiovascular risk. And if you're having symptoms you've been writing off as age or stress or menopause, sudden facial warmth, positional headaches, vision changes that come and go, measure your pressure during those episodes. Your body might be trying to tell you something. Before we finish, everything in this video is for educational purposes only. It's not medical advice, and it's not a substitute for talking to your own doctor. Your situation is unique. Your doctor knows your full health picture, your medications, your history. Use this as a starting point for that conversation, not a replacement for it. If you found something here that clicked, leave a comment and let me know what stood out. And if this helped you make sense of symptoms you'd been dismissing, share it with someone else who might need to hear it.